Hello ladies, today I'm going to talk about a condition that across the world almost 11% and I've read as high as 15% of women suffer from. Endometriosis. Now, there are some kind of confusing things about endometriosis, but there are also some commonalities that I want to cover today. So let's dig deep into it. Well, endometriosis by name, for example, is a little bit confusing because the lining of the uterus is called the endometrium. But endometriosis really encompasses when the endometrial tissue is evident on the outside of the uterus. Now, it can be thickening inside the uterus, but it also can be present outside the uterus. All right? Now, knowing that, how did it get there? How did it go from having a normal endometrial lining to all over, even to the pelvic cavity? And in some instances, they've even found it in the breasts, in the lungs, in the lymph nodes, and once again, traveling and circulating through the body. Now, that's not as much as common as it is in the pelvic cavity and around the uterus, all right? So what I want you to think about is this. What's a commonality? Well, they always say that there's so many causes, but most of them are unknown. Well, but when you start to look at all of the endometrial foundations and all the things that they do and all the research in Mayo Clinic and UCLA and all of them, there is one common theme that holds it all together, is there is some hormonal problem. That's why if you look, okay, there is some factor that happens where they give some form of hormone therapy. Now, if you see, it's very common for women to take some pain medication because the tissue growing outside outside the uterine area is very difficult, okay? So you'll see very commonality is pain medications or therapies, but there's a lot of hormonal therapy that they do, including, if you look on one of them, Depo-Provera. Why? Because they're trying to shut down the amount of estrogens that a person has. That's why birth control is a very common thing to this. And I know when you guys watch this video, you say, yeah, doc, you know something? I end up going on birth control and I did see progress. I did have a hysterectomy and it was so much better. I don't disagree with that. I can't take that experience away from you. What I want to do in this short video today is give you the common theme that I see with it and the experience I have and maybe guide you a little bit of different thinking on this, okay? And so when we see such a big hormonal problem, there is one thing I do see universal when our offices have seen endometrial, people that suffer from endometriosis from all over the world. Number one, their testing hormonally was incomplete. As we know that the majority of people that suffer from endometriosis actually kind of have high estrogens. But the one thing that is very frustrating for me as a clinician, okay, because women, man, they're suffering when they have this. It's bad, it's devastating. So when they do bring our labs to us, and this recently just happened within a week, had a woman suffering from there. She saw really good doctors. They actually gave her some, medication, help her get through the very painful times because she was just torn up and laying on the floor in pain, and the stories was devastating. But then what happened is they gave her a form of birth control, but she had a bad reaction. So therefore she couldn't continue with that therapy. But they said, well, let's see where your estrogen levels are at. And what happened was they measured two of them and they were both normal, so they were kind of scratching their head. And I looked at her, I said, listen, thank God that doctor did it. He was on the right path searching for that. But the testing was incomplete. Below in the link below the video, we're going to put the links of what labs you should have done, because that gives us a great picture of the one commonality that is there, and that's some hormonal problem that way. So I'd rather, from the standpoint of the wellness way, what we want to do is this. We don't disagree that there's multi-factors, but the commonality being hormonal, we want to get a big picture of all the hormones of you young ladies to actually see, are those things off? And then what can be done besides hormone therapy, besides birth control, besides, actually having a hysterectomy, and to possibly get you in a direction that is different than what you've been shown so far. So endometriosis in a nutshell is, guess what? A lot of that endometrial lining tissue is showing evident in the whole pelvic cavity and around certain organs. And guess what? There are many factors, I don't disagree with that, but there's one commonality from all research that they look at, and that's some hormonal component. What I'm coming to you from a different perspective today on this video is let's get the complete view of all of your hormones, because what I'm seeing out there when the doctors are trying to do a wonderful job with these ladies is the testing is incomplete. Let's do this. Go to the links below and get the proper testing done, and let's really see what's going on with you.